Afternoon. The briefing will now commence. Good afternoon, and thank you for joining the briefing entitled "Building a Community-Based Contact Tracing Workforce," held by the Committee on Education and Labor. I want to remind everyone that this briefing is a public-facing event. A recording and audio and video of the event will be made available to the press and the public shortly after it concludes. I want to note that we invited the minority colleagues to the briefing, but we were informed that they do not intend to participate. However, the briefing is still open to all committee members, and we continue to invite all of our colleagues to participate today. This is not a technically official committee activity, so there will be no official record for this event. Any member who wishes to share a relevant statement, article, letter, or other item may do so aware of the personal office's communication methods. Also want to remind methods to please keep your microphones muted and your camera videos turned off unless you're speaking. I think this is different than the normal committee meetings where your presence is, you need to maintain your presence by holding your video on, but on briefings, you do not have to do that. Turn your video cameras on and your microphones on when you wish to speak. And please remember to turn them off again when you're done. Any member using a telephone that is audio only, *6 will work to unmute and remute your phones. Anyone experiencing trouble connecting during the briefing, please contact the committee's IT director, Sheila Havener, or the chief clerk, Talisa Ali, by email or phone. Their email addresses and phone numbers were sent out with the notice for the meeting. To begin the briefing, the clerk will conduct a roll call. This is simply to get a sense of who is on the call at this time. So members, please remember to unmute yourselves when in response to the roll call. Madam Clerk.
Chairman Scott.
Present.
Mrs. Davis.
Present.
Mr. Grijalva. Mr. Courtney. Ms. Budge. Mr. Sablon.
Here, present.
Ms. Wilson. Ms. Bonamici.
Present.
Mr. Cano. Ms. Adams. Mr. Desaulnier. Mr. Norcross.
Present.
Ms. Jayapal. Mr. Morelli.
Present.
Ms. Wild.
Present.
Mr. Harder. Ms. Bass. Ms. Schreier.
Present.
Ms. Underwood.
Present.
Mrs. Tate. Ms. Shalala. Mr. Levin.
Here.
Ms. Omar. Mr. Trone. Ms. Stevens. Mrs. Lee. Mrs. Trahan. Mr. Castro. Mrs. Fox. Mr. Rowe. Mr. Thompson. Mr. Wahlberg. Mr. Guthrie. Mr. Byrne. Mr. Grothman. Ms. Stefanik. Mr. Allen. Mr. Smucker. Mr. Banks. Mr. Walker. Mr. Comer. Mr. Klein. Mr. Fulcher. Mr. Watkins. Mr. Wright. Mr. Muser. Mr. Johnson, Mr. Keller, Mr. Murphy, Mr. Van Druten. Chairman Scott, this concludes the roll call.
Thank you very much.
Mr. Chairman, Takano is present.
Thank you. Anyone else not respond to the roll call?
Trahan is present.
Hand, thank you. If anyone is experiencing any trouble connecting during the briefing, you have those instructions. So in a moment, we'll hear from our distinguished experts, but after our experts finish, we'll open the floor for questions. As this is an informal committee briefing, instead of recognizing members in order of seniority, I'll recognize members in order in which they seek recognition to ask a question by indicating they have a question in the chat box. Members who are using a telephone audio only should have a staff member indicate their interest in the chat box on their behalf. Again, if you wish to ask a question, please indicate so in the chat box or have a staff indicate that for you. This briefing is 1 hour, and we're very pleased to have experts on hand who've made themselves available to discuss the issue with us. Members are advised to ask questions succinctly, and please consider other members waiting in the queue to ask questions. A chime will sound as a reminder to members to wrap up their questions. I now recognize myself for an opening comment. With states across the country relaxing stay-at-home orders, we are facing a pivotal moment in our effort to end the COVID-19 pandemic. Contact tracing, which helps identify, inform, and isolate people who have been exposed to COVID-19 before they potentially spread the virus, is essential to that effort. In fact, the public health experts estimate that the United States will need between 200,000 and 300,000 contact tracers to really control the spread of COVID-19. Unfortunately, there are only 2,200 contact tracers in the entire country, and the current workforce does not reflect the diversity needed to reach our most effective communities. Making matters worse, this administration has done little to address this shortage. I'll now yield to our committee's vice chair, Andy Levin of Michigan's 9th Congressional District, to discuss what Congress is doing to expand contact tracing workforce and to introduce our experts. Drawing from his experience as director of Michigan's workforce system, Congressman Levin has been an outstanding leader in our effort to secure more contact tracers in response to this pandemic. Representative Levin.
Thank you so much, Mr. Chairman, for yielding and for your steadfast leadership of this committee in general and on this issue in particular. All know the House recently stepped up to pass the HEROES Act, a 5th legislative relief package in response to this pandemic. The HEROES Act includes a $75 billion investment to meet the country's testing and contact tracing needs. This proposal includes key parts of legislation I introduced with Senator Warren and others, the Coronavirus Containment Corps Act, which provides $500 million to help state and local workforce agencies connect unemployed individuals with contact tracing employment opportunities. Importantly, it also recognizes that we need diverse and locally based contact tracers who can build the trust needed to serve the communities in which they work. And I note that diverse includes speaking all the languages necessary to reach folks in their communities. By building a robust national contact tracing workforce, we would take a critical step towards solving 2 challenges. First, we would build the contact tracing capacity needed to stop this virus dead in its tracks. Without it, we really don't have much of a hope as we reopen. And second, we would help the record number of unemployed Americans re-enter the workforce and contribute to our recovery effort in a way that they would remember for the rest of their lives. The name of our proposal, the Coronavirus Containment Corps, or CCC, pays homage to FDR's own CCC, the Civilian Conservation Corps, which put hundreds of thousands of Americans back to work, rebuilding our country during the Great Depression. We must use the same imagination that lifted our country nearly a century ago if we're going to safely recover from this crisis. Today, we are joined by Dr. Ashish Jha and Abby Snade to discuss why we must expand our contact tracing workforce and the work we still must do to achieve that goal. Dr. Ashish Jha is professor of global health at Harvard's T.H. Chan School of Public Health and the director of the Harvard Global Health Initiative. He's also a practicing general internist and professor of medicine at the Harvard Medical School. Abby Snade joined the California Labor and Workforce Development Agency in January as Deputy Secretary for the Future of Work. During the COVID-19 pandemic, she's focused on developing employment opportunities for laid-off workers through the expansion of essential public services and private sector partnerships. And I might add that Abby is a respected national voice in workforce policy from her many years in the nonprofit sector before she joined the state of California. Thank you both for your time today, and I look forward to the briefing. With that, Mr. Chairman, I yield back.
Thank you, Congressman Levin, and thank you to our witnesses for being with us today. We'll begin with Dr. Jha.
So good afternoon, Chairman Scott and Congressman Levin and all the members. I hope you can hear me okay. I am very pleased to be with you this afternoon to talk about where we are with the pandemic and why contact tracing is so essential. More than 100,000 Americans have died from this virus. And right now we are on pace such that we have about 25,000 people dying of this disease, projected to be dying from this disease over the upcoming months. And I suspect we will pass the 200,000 mark by September. That is a lot of suffering and a lot of deaths ahead of us. This is not fated. We are not destined to have to live that future. And it is up to us whether we act in ways that prevent those illnesses, that prevent those deaths. And the single best tool we have for bringing this virus under control, for saving hundreds of thousands of lives, and for getting our economy up and running is an effective testing, tracing, and supportive isolation program. There is nothing else. While we are all hopeful for therapies and vaccines down the road, in the upcoming weeks and months, we only have one tool to bring this disease under control. And while testing has gotten a lot of attention, and rightly so, and while our country continues to have insufficient number of tests, what has received less attention has been contact tracing and the importance of contact tracing. And so let me just say a couple of things, and we'll deal with more things in question. Fundamentally, contact tracing is essential if we're going to identify people with the infection and help isolate them so they don't spread the infection to others. One of the biggest challenges of this virus is that almost half the spread happens from people who are asymptomatic. Identifying those people is essential. Just having a program that tests people when they have symptoms is not going to be enough. A key part of contact tracing is identifying people who may not have any symptoms at all, but are still positive and still spreading the virus. That has been a major source of why we've seen outbreaks in nursing homes, in meatpacking plants, in workplaces, and churches, and other houses of worship around the country. So with an effective contact tracing workforce, we can get our arms around this disease. How many contact tracers do we need? We already heard from Congressman Levin as well as Chairman Scott that there are several different estimates out there, somewhere between 100 and 300,000, probably closer to 300,000 contact tracers. And what will drive that is the amount of disease burden we have and how much contact tracing we want to do with each individual case. Let me finish up with just one other important comment. There's been a lot of interest and excitement about technology as somehow ability to circumvent building a contact tracing workforce. The idea that technology can replace contact tracers. They cannot. Fundamentally, contact tracing is about building confidence and trust in people to change their behavior. While technology, I believe, can be an important aid to the process of contact tracing, we should not believe that somehow it can replace the need for human-to-human engagement, human-to-human trust building, human-to-human activity that will allow people to change their behavior, to isolate themselves, to get tested and protect their friends and family. So I am very pleased that this committee has taken this on, and Chairman Scott, thank you for your leadership here. And I am happy to conclude my remarks at this point and take questions after Ms. Snee has had a chance to speak as well.
Thank you very much. Ms. Snee.
Thank you, Chairman Scott, Congressman Levin, and members of the committee and House. Thank you for the opportunity to talk to you today about a community-based approach to contact tracing. Over the course of the past few months, as physical distancing and stay-at-home interventions have helped flatten the curve at a steady rate in our state of California, as we gradually reopen sectors of our economy and move outside our homes and mix with others outside of our households, the risk for exposure and infection also increases. If we do not plan our reopening in an intentional manner, we risk a significant resurgence in COVID-19 infections, hospitalizations, and deaths. An essential component, as Dr. Jha mentioned just now, to efforts to contain the spread of COVID-19 is timely case identification and contact tracing. While intense work is focused on a COVID-19 vaccine and effective therapeutics, we do not expect that these will be available for many months. To continue to loosen restrictions, we must take a multi-pronged approach, which includes immediately scaling up a robust contact tracing plan and effective isolation or quarantine of those who are infected and exposed to COVID-19. The California Department of Public Health projects a need for at least 20,000 contact tracers as infections spike with counties reopening businesses and services, and has initiated what we call phase 1 of a workforce strategy. This strategy recruits, trains, and redeploys current state and local workers as contact tracers. To date, over 1,000 state and local workers have received training toward a goal of 10,000. So we're off to a slow start. State departments and agencies have been asked to contribute 5% of their workforce for contact tracing roles. But phase 1 will not reach the goal of 20,000 contact tracers. A phase 2, which is dependent on federal reimbursement, would recruit and hire new employees to fill these roles. Tapping the pool of laid-off workers in communities most affected by the pandemic would bring language and cultural competency to make the tracing more effective, and at the same time reemploy people who lost their jobs as a result of the pandemic. With the majority of layoffs occurring in the hospitality, retail, and service sectors, laid-off workers would bring transferable skills that would make them highly effective contact tracers. Communication, emotional intelligence, problem solving, the ability to function and communicate on a team, engage and build trust, and demonstrate critical thinking. Cultural affinity and linguistic skills are critical to reaching out to certain communities, and contact tracers hired from those communities would bring the ability to put people at ease, connect, and reduce their fear and their shame. Although contact tracer roles are likely to be temporary, lasting 6 to 9 months, workers who transfer their skills successfully will be well poised for additional career pathways in public health or in healthcare. This work experience can open new possibilities for workers from vulnerable communities, putting them on new life trajectories and bringing increased diversities to healthcare providers and systems. The public workforce system and its community partners are well poised to recruit, train, and support a community-based contact tracing workforce and meet the dual goals of strengthening the efficacy of contact tracing through culturally and geographically competent contact tracers and re-employing laid-off workers or averting layoffs of workers from those communities most affected by COVID-19. With reach into communities of color disproportionately stricken by the pandemic, workforce organizations could quickly and effectively recruit laid-off workers, and working closely with local health jurisdictions, assess their skills and backgrounds for contact tracing roles and expedite the hiring process. With online training for contact tracing provided by the state and counties, these workforce partners would support new workers and to be successful through the training and on the job. These jobs are highly demanding, and job coaching would bring the extra support to ensure success on the job and also start planning for next step employment or further training. Current funding for workforce programs, even with the $345 million recently awarded by the CARES Act, which does allow for contact tracing, does not go far enough to address the needs of the 40 million Americans who have lost their jobs. The HEROES Act contains $500 million for workforce partners to recruit, train, and support contact tracing. With these funds going both to public workforce boards and sub-granted to community-based organizations, we can reach deeply into the communities most affected by COVID-19 and job layoffs and create a powerful partnership between the public health system and the country's workforce system. Exactly what we need to contain the virus, get thousands of people back to work, and start rebuilding the economy. Thank you.
Thank you. And this is excellent testimony, very helpful. We'll begin questioning with our Vice Chair, Mr. Levin. After he goes, then we'll have Morelli, Sablon, Underwood, and Schreier. Mr. Levin.
Thank you very much, Mr. Chairman. Dr. Jha, let me ask you to comment from a public health perspective on an issue that Ms. Snee, raised and began to talk about. Why is it so critical to build a contact tracing workforce that reflects the diversity of the communities in which they'll serve, from the point of view of effectiveness of the work and of, succeeding in this effort to reduce the spread of COVID-19?
So, Congressman Levin, thank you for that question. And you actually answered it. It is all about the effectiveness of the work. The bottom line is this: as human beings, we're not machines. You don't get a phone call and head off and go do something. We're asking people to stay at home because they may have come in contact with somebody. We're asking them to go get a test. If they turn positive, that has real repercussions for them, for their families, for their workplaces. And we need contact tracers who understand those issues, who can talk to people in ways that people understand, can address the fears and concerns that people have. And so this is one of the reasons why this idea that has often been floated, that if we just had an app for that, we could solve all these issues. There's no app for cultural competency. There's no app for understanding human motivation. There's no app for understanding what motivates people to take care of their families and themselves and their coworkers. So this is why the kind of workforce that Ms. Snee laid out is what is absolutely essential if we're going to be effective at getting this job done.
And just to emphasize, that really obviously includes language competency, right? I mean, in my district, we have many people who are monolingual speakers of Arabic or Chaldean Aramaic or different languages. You pretty much need someone who can speak to you in your native language, right?
Absolutely. So it's language, it's culture, it's understanding a whole host of issues. It's somebody who gets you. It's somebody who understands you and your circumstances. And as you know, Congressman, that comes in many different shapes. But language is essential.
Thank you. Yeah. Thank you so much. All right, Ms. Snee, let's talk about how we can do this. We need to do it quickly. We need to do it in this culturally sensitive way that you and Dr. Jha have now both mentioned. Talk about the role of the workforce system here. It's not something that's widely understood, by the public, or, why is this so important, and what role can the workforce system play in making sure we quickly stand up a culturally competent workforce here?
Well, our country's workforce system has spread across every state, every county, every region through local workforce boards, and most importantly, with community-based partners. who often have very deep connections to the communities that we really care about now in terms of the pandemic and in terms of being good contact tracers. And we have 40 million unemployed people across the country, over 5 million in California alone. Even as of the second week of May, we had over 400,000 healthcare workers and social assistance workers laid off. So we have contact with those people, access to those people, and trust with those people. Our workforce system and our partners are deeply experienced in conducting outreach. Now we're doing it all virtually, bringing people in to help them prepare for jobs, refer them to training, and most importantly, our work doesn't end when somebody gets a job. And especially in these roles, as Dr. Jha was describing, this is hard work. People can talk to 50 people a day, and people who've just learned that they've been tested positive, and the contact tracers themselves need support. Also, much of this work is being done remotely, and people in the communities we're most concerned about may not have broadband access, may not have the setup in their home to do remote work. And so our system can provide some of those wraparound and support services to help people be effective in those roles.
Thank you, Mr. Chairman. I yield back.
Thank you. Next is Mr. Morelli.
Thank you, Mr. Chairman, for conducting this important conversation. And also thank you to my friend and classmate, Mr. Levin, for helping organize this. I wanted to just spend a moment, if I can, talking about my community, Rochester, New York. We have no strangers to the benefits of contact tracing. The Monroe County Health Department has worked to trace sexually transmitted diseases for several years, and the system they had in place, we were able to effectively adjust to be able to address COVID-19. I'm also very proud in mid-May, the county signed up over 600 volunteers to participate and help out with contact tracing. We have a community of about 700,000 people. It sounds like on average, we're looking to have about 1,000 or a contact tracer per 1,000. So we're right at about the number that we need, and the state health department has helped fill in some of the gaps. Obviously, this is an incredible challenge, and appreciate very much Dr. Jha and Ms. Snay's participation here today. I wanted to just ask, we have done a lot with remote phone calls, remote imaging, and conferencing like this, text, to ensure there's no risk of airborne transmission to the tracer. But I wanted to just drill down a little bit on what the two panelists have said about in-person contact tracing and why that's so valuable. And Dr. Jha, can you, talk a little bit more about the advantage of in-person contact tracing in terms of state and local efforts, and why that's so important, particularly with communities of color that are underserved and are having a disproportionate impact as a result of the disease?
So Congressman, absolutely. So first of all, I do think it's really important to understand that the virus has not affected all Americans equally. We have seen a very disproportionate effect of this virus on communities of color across the country. And the numbers are really quite shocking in terms of how much of a difference there is, both in terms of people getting infected and then also having very poor outcomes as a result. And there are many factors that go into it. Long-standing policies born from a history of racism, I think, is at the heart of a lot of what has contributed to this. But we have to figure out how to do better in the rest of this pandemic. I've often described that we're probably about in the third inning of a 9-inning baseball game in terms of this pandemic. We have a ways to go. And I think particularly for communities of color, the idea that the contact tracer is somebody who understands that community, is from that community, can speak to the issues in that community and the challenges that people will face if they get tested, get isolated. So I think, and obviously we'd love to do as much of this in person. In some places, that's not going to be safe based on depending on the level of the disease burden in that community. And so you're going to have to do this by phone or through video conference. But I think particularly for communities of color, this is going to be an essential element if we're going to be effective at contact tracing.
Very good. I think that bell means my time has expired, so I yield back, Mr. Chairman. Thank you.
Thank you. Next is Mr. Sablon, but after he goes, there'll be Underwood, Schreier, and Adams. Mr. Sablon.
Yeah, thank you, and good morning, everyone. And I said morning because I am 15 hours ahead of you. Thank you, Mr. Chairman, for having this hearing. Thank you to Mr. Levin for coordinating this, and our two participants, Dr. Jha and Ms. Ney. CDC teams recently came to the Marianas and familiarized themselves on the first day with the contact tracing teams here. And you know, I've always had a joke that if you live here in the Northern Marianas, you get fever and have to leave once or twice here to go to a city, you know, either Japan or Manila or Guam to, you know, but right now we're actually glad we're so small and so isolated that we've only had as of today 24 cases since this whole thing started. So, but yeah, I agree contact tracing is important. The CDC team were able to recommend and strengthen the process we have. So, Dr. Jha, when states and territories strengthen their capacity to conduct widespread contact tracing, how can local hospitals, and we have one, how can local hospital systems or other healthcare providers coordinate with contact tracers to prepare to treat COVID-19 patients and streamline access to care for communities that have been disproportionately affected by the pandemic? And would there be any challenges?
So I had some difficulty hearing Congressman Saban. Did anybody else? I think you were asking about local hospitals and how they can play a role.
Yes, or you know, just generally hospital systems. How can they coordinate the?
Yeah.
You know, because some of the patients are going to be faith-based, some of them are community organizations. Yeah, they need to.
Absolutely. Absolutely. So Congressman, I think I caught most of that. And let me say, you're absolutely right. That what we need a partnership between the local healthcare system and this public health entity. I believe it's very important that the contact tracing workforce sit within the public health infrastructure, not necessarily be part of the healthcare workforce. We don't necessarily need doctors and nurses. It's a different set of skills. But that said, it is absolutely critical that when you identify people, especially people with illness, you need to be working hand in glove with the local healthcare providers, the doctors and nurses in clinics, in community health centers, the local hospital. And that integration really has to be there, because otherwise you're not going to get the effectiveness that we need. We need to be able to promise people that if they get sick, that they will get taken care of, and that there is a connection between the contact tracing that's happening, the public health workforce, and the local hospital and the local community. So I think that's a critical issue. I think, Congressman, is probably not an issue that has gotten enough attention. And I think as cities and states really build up this workforce, making sure that that connection is there is going to be critical.
My time. Thank you. Thank you, Mr. Chairman.
Dr. Jha, I want to point out we have legislation pending that if you incur medical expenses that because of COVID-19, it should be without copay and deductibles. But we haven't passed that yet, so we're still working on it. Ms. Underwood.
Thank you, Mr. Chairman, and thank you to our panelists, Ms. Ney and Dr. Jha. This is an urgent topic. To fully and safely reopen our economy, we need to be able to significantly expand our testing and contact tracing infrastructure, which is why we introduced the bicameral Health Force and Resilience Force Act. For Dr. Jha, my bill is unique among proposals to expand testing and tracing because the Health Force makes a sustained commitment to communities that extends beyond the COVID-19 pandemic public health emergency. Can you explain some of the work that local health departments conduct year-round to ensure the health and safety of their communities?
Yeah, Congresswoman, thank you for that question. Absolutely. You know, one of the reasons we were caught so flat-footed with this pandemic is that we have had year after year across America cuts in our public health workforce, reductions in financing and support of public health. And while we have an urgent public health crisis now, it is absolutely critical that once we are done with this crisis, we never find ourselves in this exact same position again. And that means really thinking about the long run while we are acting in the short run. Public health workforce, including community health workers, in fact, but the public health workforce does a lot of things that we don't pay attention to, and we only notice them when they are not there. They keep our food supply safe. They make sure that restaurants we go to don't give people illness. They track down disease outbreaks in our community. They make sure that the water that we're drinking is safe. There's a whole set of things that public health workers are doing on an ongoing basis. And we always say that when they are being successful, nobody knows that they're there.
That's right.
But unfortunately, we're at a point where we are noticing that they're not there.
And our bill provides funding for local health departments to hire members of the community, particularly those who lost their jobs during COVID-19, to support public health initiatives like contact tracing. Ms. Ney, why is it so important to have local community members leading contact tracing efforts?
Well, as Dr. Jha is explaining, contact tracing is extremely difficult work. People who've tested positive are often reluctant to talk, especially from communities that have mistrust of government officials. And so having contact tracers who come from those communities, who bring the language skills, the cultural competency, even the geographical knowledge, can make all the difference in the world in having people really, be able to share just who it is they would have come in contact with, and also to help them and how they can effectively isolate themselves and keep from infecting others.
Thank you. And so in addition to contact tracing, the health force will support the administration of testing in public health departments. Dr. Jha, your team at the Harvard Global Health Institute has estimated that the U.S. needs to conduct 900,000 tests a day in the United States in order to reopen safely. Can you describe the importance of bolstering our public health workforce to reach this level of testing?
Absolutely. So there are many things that go into testing, probably about 1 million people a day. Obviously, you need the tests, you need the reagents, all of that, but you need people to actually do those tests. And it's critical that we take that testing infrastructure out of the healthcare system. We don't want everybody going to the emergency department or the hospital. We really need a public health infrastructure to conduct that testing.
Thank you all so much for joining us today, and I yield back, Mr. Chairman.
Thank you. Dr. Schreier.
Thank you to Mr. Chairman, and thank you to our panelists. This is such an interesting discussion. I'm a pediatrician, so I'm totally bought into public health and contact tracing. I've used it for pertussis, for STIs, and this is just going to be bigger than anything we've ever done. I wanted to go just a little bit deeper, kind of the what comes next, because I represent a district that's part suburban, super easy to contact trace. Lots of people can work from home, no problem. And rural areas that are impacted very differently. And just to paint the picture, Yakima County is agricultural county, heavily Latino, represents about 3% of Washington State's population, but 18% of the cases, twice the death rate, and 25% of their tests are positive. So we're seeing a very different situation there. We also have, in many cases, a very young population. And so we have this confluence of factors, young people with no symptoms who test positive, and you're telling them they can't go to work, which means they can't feed their families, and there may be multiple generations that they're supporting. We have the notion of some people in the family who may not have documentation and a level of trust, even if it's a member from their own community. We have multiple generations. And so if you want to protect the grandparents, how do you isolate people away from home when you have this interdependent structure? And this notion of being asked to sacrifice income. Not just that, we've passed, good sick leave and family leave policies. 1-2 week period of sick leave, and then you're done. And even with testing, I mean, in our state, if you're testing with symptoms, it's covered. But if you're testing for surveillance, it's not covered. And so we've got all these gaps in the system. And I was wondering if you could talk about the implementation. How do we do this and compensate people for all of the losses they take?
Yeah, maybe I'll start. Congresswoman, thank you for your question. You're absolutely right. It is multifaceted, requires us filling in all of these gaps. The fundamental issue is if you say to somebody, so if we don't have enough testing, first of all, let's just think about that as a problem with contact tracing. You're going to ask people to self-isolate for weeks without being able to test them to rule them out. That's going to be a huge problem and a very big challenge. Obviously, if you test people and they test positive, you need to make it easy for them to do the right thing. And asking people to sacrifice income, asking them to not be able to support their families, these are going to be very, very difficult things. Even the most adept contact tracers are going to have a hard time convincing people. So that's why it's testing, tracing, and supportive isolation, not just isolation. And really, states need congressional help to implement those kinds of policies. You're absolutely right. One of the major problems we've had with testing so far is we've been testing symptoms. We have not moved into a surveillance mode. We need to get into surveillance mode for nursing homes, for hospitals, for meatpacking plants, other workplaces. That's why we need millions of tests a day to be able to do that. We have to make sure that people are not financially burdened from those tests, because if that creates a financial burden, people are not going to engage in that. And we as a country are going to end up being worse off. So you're absolutely right. We have to go much deeper into each of these policies.
Can I sneak in a tiny question for Ms. Snee?
We have a number of other members,
Okay.
Dr. Schreier, with all
I
due
will wait. I'll put it in the comment box in case somebody else wants to ask. Thank you very much.
Thank you.
We have Dr. Adams, Dr. Trahan, Ms. Trahan, and Mr. Takano. Dr. Adams.
I think you're on mute.
Alma, you're still on mute.
Okay, what about now?
You're good. You're good.
That's good.
Thank you. Thank you very much. Thank you for Chairman Scott, Vice Chair Levin for convening the briefing today, and to our panelists, thank you for sharing your expertise. Dr. Jha, some public health experts estimate that the United States needs between 200,000 and 300,000 contact tracers to prevent the spread of COVID-19. However, contact tracing recruitment and hiring requires additional resources. So what barriers could disrupt state efforts to build a contact tracing force and a tracing workforce? And what resources can Congress provide to help states avoid possible delays?
So Congresswoman, thank you. If you don't mind, I'm going to actually I think Ms. Snee has really been at the heart of this work. So if it's okay with you, Congresswoman, I'm going to ask Ms. Snee to answer. I think she's more expert on this, but it is a fundamentally important question, if that's okay.
Right, that's fine.
Thank you, Dr. Jha. And Congresswoman Adams, I would go back to the HEROES Act, which the House passed several weeks ago. The HEROES Act includes $500 million for national dislocated worker grants to state and local workforce agencies to support the recruitment, training, transition to further employment of contact tracers. These funds are critical and really the only way we could do our job of recruiting and supporting people. And in my view, the language in the HEROES Act around contact tracing recruitment is very well crafted in that it identifies specifically the components that the workforce agencies would perform to expand contract training workforces across the country. What I also appreciate is the 30% allocation for subgrants to community-based organizations who really have the connections in the communities most affected by both the pandemic and unemployment. And as we've been talking about, really bring the language, cultural competency, and empathy, special empathy that will make them effective contact tracers. The language in the bill also calls out the role that the workforce system can play in helping contract tracers transition out of those roles once, God willing, the pandemic is contained. And for some,
Whoa. I think she's frozen.
Ms. Shea, you froze a little bit.
So, Ms. Scott, can I ask my other question?
Yeah, please do, and we'll wait for Ms. Shea to come back. Go ahead.
Okay, June 1st was the start of hurricane season here on the Atlantic coast. We've seen 3 named storms, and scientists say that we're going to see more. We've had concerns in my home state here of North Carolina that hurricanes could delay contact tracing efforts in coastal communities. So what other unique situations are states and local areas grappling with that Congress needs to consider? And either panelist can answer if they'd like.
Ms. Snee, you're on mute. Ms. Snee, you're still on mute. Ms. Snee, I think you're okay now.
can you hear me?
I can hear you now.
Okay, I'm so sorry. And I had lost connectivity for a moment and I did not hear the question. I apologize.
Well, what I asked was the start of hurricane season is here. June 1st was the beginning. We've seen 3 named hurricane, 3 named storms. We expect there's going to be more in North Carolina, my state. These hurricanes could delay contact tracing efforts in coastal communities. So what other unique situations are states and local areas grappling with that Congress needs to consider?
Well, in my state, we are fearful of another we are facing another wildfire season. It was a dry winter. We did not have adequate rain or snowfall, and so the threat of wildfires on top of the pandemic, on top of the raging unemployment and the momentary possibility of earthquake are other threats that make this all even more complicated.
Okay. All right. Thank you very much, Scott. I'm going to yield back.
Thank you. Ms. Trahan?
Thank you, Mr. Chairman, and thank you for referring to me as doctor, even though it was maybe by mistake. I'm grateful for the panel and grateful for Dr. Jha and Mrs. Snee's testimony. Dr. Shah, you were kind enough to join me for a couple of teletown halls in the past few months, and you were sounding the alarm throughout in terms of our preparedness for and maintaining a state of readiness after we get through this first wave. But I want to ask about something different, just because it's been touched upon a bit. But as you well know, there's been a fair amount of misinformation around COVID-19. Some still claim it's no worse than a seasonal flu, which we all know that's far from the truth. Our president was prescribing hydroxychloroquine, despite the fact that it wasn't meant for use against COVID-19. And back at our last teletown hall several weeks ago, you gave another good example. You said, every day we hear from the president that we have enough tests, and we don't have enough tests. So I worry that the sum total of misinformation, as well as the diminished trust in public institutions from the White House right on down, it's harming our ability to effectively communicate the urgency of following proper health and safety protocols. And this misinformation may make it especially challenging for contact tracers who may be complete strangers to those from whom they are soliciting information. What can we do to combat this misinformation and increase our odds of ensuring the level of compliance necessary to beat COVID-19, both this current wave as well as the next if and when it comes?
So, Congresswoman Trahan, thank you, and thank you for having me on your teletown halls, which, as you know, I very much enjoyed. This is a huge problem. Look, the pandemic is hard enough, right? The worst pandemic in a century, combating it is hard enough. Throw in combating that on top of all the misinformation is making it extremely difficult. And as you said, we continue to have people downplay it. We continue to have people say that we have more than enough testing, more than enough capacity to deal with this. And yet the evidence is clear. 107,000 Americans have died as of this morning. We do not have this under control. So what would I like to hear? I would like to hear from our nation's scientists. We had, before this outbreak, the world's leading public health agency. I want to hear from the top scientists at the CDC. I would like to get a daily briefing from them about the state of the virus, the number of infections, and how our country is doing. We have not heard from the scientists at the CDC. Now, thankfully, we have heard from Dr. Fauci and Dr. Birx. There is nobody more respected than Dr. Fauci. I would be delighted to get a daily briefing from Dr. Fauci. But we need to get the science and evidence and data from the scientists. We need them in our public sphere, and we need, I believe, we need Congress to demand from the CDC and from the White House that scientists speak about the state of the virus and how it is that we're going to get our way through this very, very difficult time.
Oh, I think my time is up. All right, thank you. I yield back, Mr. Chairman.
Thank you, Dr. Trahan. Ms. Bonamici.
Thank you, Mr. Chairman, and to our panelists for this important discussion. I'm here in Northwest Oregon, and here each county has to show that it has a requisite number of contact tracers to open back up. So it's been a real challenge to find people with the skills, with the language that's appropriate, and the knowledge of the community. In fact, one of our local reporters said about the job, they're working long days and weekends doing a job that's less like CSI Miami and more like conducting a telephone poll. It's deceptively complex to gather the information critical to slowing COVID-19. They must combine the relentlessness of a bloodhound with the cheery nature of a telemarketer in what can be a life or death situation. So, you know, when you think about all the people who are, and a lot of people have been stepping up saying, I'm interested, but assume that somebody does that. And how long is it going to take them until they can start? Is there some sort of program or curriculum? How does somebody learn how to do this in a short period of time? What does that look like? And also just to follow up on what Representative Dr. Trahan was saying, about the fear in the communities. I'm very concerned. There was an NPR article just yesterday about the threats and the fears, and it really, in some places more than others, has become politicized. And there was a comment in there about how Colorado public health officials, 70% of them have been threatened. So I just want to, I would really like an answer about how do we get people prepared, assuming that they're ready, willing, and able. How do we get them prepared? What does that look like? And then if there's time to comment on how do we overcome the political challenges to this important work? Thank you.
Sure, I'm happy to jump in and answer. As Dr. Jha said, contact tracing is not new. Contact tracing has been used for investigations of other diseases. There are excellent curricula out there from the CDC, from professional associations. In our state, we contracted with UCSF and UCLA to develop a 5-day online training that goes through the basic tasks, plus the motivational interviewing, how to get people to listen, some of the skills in health coaching, in healthcare navigation. So the combination of that training, the support that people can get on the job, as well as the recruitment and selection of people who can bring skills they honed in other occupations. When I first started investigating contact tracing, someone with a long history in public health told me the best contact tracer she ever hired was a bartender who had just spent his career listening to people's problems and talking to them and being a good listening ear. So I think we know how to do this, and unfortunately, we have millions of people with these really good skills, eager and ready to be retrained for contact tracing roles. It's good and it's bad, right?
Yeah. And that 5-day, how much does that cost to do that 5-day training?
It is free to the individual. The state,
yeah. But the state or the public health office has to pay for it, I assume.
Yes, because it's online. I mean, the state had a contract of just under 10 million with UCSF and UCLA to design that training, which is now available to everyone in the state.
Thank you.
So the cost of training itself is not that expensive. It's the recruitment and the ongoing support. Exactly. And most importantly, and what we are really looking to Congress to do is not only to fund the infrastructure for recruitment, but the funds that will support the tracing roles themselves. That's the biggest gap.
Thank you. I'm going to yield back and see if we can get another question in. Thank you, Mr. Chairman.
Thank you. We have McBath, Davis, Shalala, and Wild. Ms. McBath, is she with us?
Yes.
Okay, there you are.
Thank you so much, Mr. Chairman, and thank you, our co-chair, my esteemed colleague and classmate, Andy Levin, and thank you so much for the guests that are joining us today. Thank you for your expertise. And I just want to, and what I'm actually going to do is that my question was somewhat answered a little bit before by both of you, so I will just go ahead and make my statement, but I'll go ahead and try to add the additional question that my colleague Kim Schreier wanted to ask. But I know that in my district and across the state, and I represent Georgia's 6th congressional district, and I don't need to tell everyone here what's actually been happening in Georgia. We know that our businesses have been reopening for some time now, and people are starting to relax on taking their proper precautions. And that really, really worries me. That very much concerns me. While maintaining social distancing and wearing a mask, they remain very vital to kind of making sure that we are mitigating this pandemic. Contract tracing is obviously the next step in ensuring that we are going to be able to contain any new outbreaks within our communities. However, as some of you have actually noted that, we do not currently have the workforce for sustainable contact tracing program. So unfortunately, we don't have, in this case, we do have a very unprecedented number of people that are out of work. So I'm very, very concerned about that, but you did somewhat answer the questions that I had concerning this. The question that I will ask will be for my colleague, Kim Schreier. She wanted to know from Ms. Snee about how to incentivize unemployed people to take jobs in contact tracing when they are being paid an extra $600 per week, currently being paid that. And are they using an incentive in California as well?
Well, I appreciate the question. And at this point in California, we are not able to hire extensively from the pool of laid off workers because we need the federal reimbursement for those contact tracing roles. So we really need your support in ensuring that that comes through. I would also say that something that worries me as a workforce professional is the expiration of those $600 supplemental benefit at the end of July. That will really be a crash in people's ability to support themselves and their families. As Representative Levin knows, I've spent over 40 years working with people who are unemployed to help them find jobs. And I have never found people who aren't excited about a new opportunity, who would much rather be working and contributing to the greater good and building their lives in new directions and having the structure and the time and the dignity of work. I think we would have no problem recruiting people and excitement among communities of color, among people who haven't had access to careers in public health and healthcare.
Thank you, Renee.
I think it's a great opportunity. Okay.
Thank you. Thank you. The time for the briefing has expired, but I'm going to let Ms. Davis, Dr. Shalala, and Ms. Wild pose their questions so that our witnesses can respond to all of them. Ms. Davis.
Okay, thank you very much. One of the issues that I think we haven't addressed, what are the range of salaries that we're looking at that's going to provide people with the opportunity for, if it's healthcare, childcare, what is really seen as required for them? How does it relate to census work and other kinds of things? And the other thing, just very quickly, is the pathway that they can think about as they begin to look at the contact tracing, but going beyond that. So how do we build that in to the entire discussion of whether they're the appropriate person, to be seeking this position? Thank you.
Thank you. Dr. Shalala?
Thank you. Let me be a little bit of a skeptic because I live in Florida and we just had the largest increase we've had since April in infections as well as in deaths. And we've also just had, as people have across the country, these big demonstrations, which may have turned out to be petri dishes. So usually in contact tracing, we have starved the virus down to the point where we can get our arms around it and follow up on all of the cases that are popping up. But we have not done all the things you need to do before you start contact tracing in much of the country. So, Dr. Jha, let me push you a little on that question. I think it's important that we hire people, train them, but they may be chasing around unless we do all the other things to get our arms around this virus, starving it in particular down to the point where it really will have an impact. But I don't know, the kid that walks in and is infected and you ask him who he's had contact with and he's in one of those demonstrations, give me a break. Thank you. I yield back.
Ms. Wild?
I think she had to get off.
Okay, thank you. Well, let me add one more question to that. How many people are typically traced when you identify somebody? How many people are typically on the list to be traced? And so, Ms. Snee, you want to start answering as many of those questions as you can?
Well, let me respond to the question about wages and training, and then I'll defer to Dr. Jha about the public health aspects. I mean, these jobs should pay a living wage, and that, of course, varies by the local area. In our state, we're looking at wages that are, that also will vary around the state, but should be in the range of $20 to $25 an hour. One of the benefits that the public workforce brings are the supportive services to help people arrange childcare, sometimes to subsidize childcare. In terms of future training, I think in an ideal program, we have our workforce partners supporting contact tracers while they're on the job and start those conversations early. What do you like about what you're doing? Who are you observing in the workplace and what they do? I mean, as Dr. Jha mentioned, we should be rebuilding a whole public health infrastructure, and there should be public contact tracing roles for the next pandemic. I've heard of ideas for classes to be held for people after they're on their contact tracing job to help them start their nursing prerequisites, other prerequisites for allied health. So this just can open up so many doors in so many different directions. Thank you.
So, Congresswoman Shalala, you're absolutely right that contact tracing alone, given the level of the burden of disease we have in our country, is not going to be enough. But let me say two things on why I remain very enthusiastic about it. On one hand, I think we believe that it's going to be part of a solution, so we need to maintain a certain amount of social distancing. We need to be doing aggressive testing. And contact tracing is not a panacea, but it's part of a broader set of activities. Second, there is pretty good data that even if you only do contact tracing and do nothing else, testing and contact tracing and nothing else, you can still reduce the disease burden some. And in terms of those protesters, I think we all understand, appreciate, and support the motivations behind the protests. I too worry a lot that those protests are going to set off new diseases, new cases. I'm hopeful that being outside will be helpful. You are right. Doing contact tracing in the middle of large demonstrations is not going to be realistic. But figuring out who else they've spent time with when they've gone home, there are other things we can still do. It will bring the level of disease burden, number of cases, and number of deaths down. We won't solve it with all of this, but it will make a big difference, and I think that is more than worth doing.
Great.
Susan, did you get your questions answered?
Yes.
And could you say how many, on a typical case, somebody's given a list. How long is that list going to be?
Yeah, so Congressman, thank you, Mr. Chairman. And there are differences in opinion. Somewhere between the estimates we've done has been 10 contacts per person. There are others who suggest we might need to do as many as 25. But I think realistically, somewhere in that range, probably closer to 10 is the right number of contacts for every case that need to be tracked down. So it's a lot of work.
Well, thank you very much. This has been very helpful. We've been working on this and obviously put a lot of money in it in the HEROES Act because we recognize it as a significant issue. My vice chair, Mr. Levin, do you have any final closing comments?
No, I'm just so grateful to you, Mr. Chairman, for doing this. I think Donna Shalala, my beloved colleague, think of all even with the problem, you're absolutely right about what you raised. We've got the auto plants reopening. We've got the meatpacking plants. We've got the call centers. Every one of those workplaces is an absolute place to have contact tracing. So no matter what is happening, we've got to have public health lead the reopening in the economy. And it's such a patriotic thing. The people who do this will never forget it for the rest of their lives. And as Ms. Snee knows, we will launch them onto new career opportunities, and they ought to get certificates. There's so much to say about, what this can mean to the people who do this work. And at this moment of incredible injustice in our society, giving job opportunities to people in our communities that are most affected by COVID-19 is something we could all feel really proud about and really great about. So, Mr. Chairman, that's all I've got to say, and I just am so grateful to you for doing this, and I yield back.
Well, thank you. And the job training component for those who are ending their jobs as contact tracers is a significant portion of the investment we intend to make. So we've had great experts. We've seen them both frequently on television. And so we want to thank them for their taking time out. I know you're both as busy as you can be. So thank you for the contribution you've made today. And if there's nothing else, the briefing is now adjourned. Thank you.